Thank you, everyone. I want to especially thank the organizers for inviting me here today, Pat, Iris, and Anne. It's really my pleasure. I'm so humbled to be on the stage with the distinguished speakers from Hong Kong as well as the international faculty. I'm also happy that some of the things I wanted to say have already been said, which will make my talk a little bit shorter, but also to note that one of the key things that I'm going to talk about is the recent global review of national cancer control plans. And so you'll see that come up as I go through. So what is a national cancer control plan? We've heard a lot about plans, and again, I'm so excited as someone who has been doing cancer control planning for the last several years to hear it just roll trippingly off the tongues of so many speakers. So we really see as a partnership, a national cancer control plan is a strategic plan, and strategy is so important. And this strategic plan helps control cancer in a country, and it's based on the country's burden, and we've seen a lot about the burden in Hong Kong, and that's really key in developing these strategies. It takes into account the cancer risk factors that a country sees, and really what resources are available to be able to implement the plan in the context of the health system and the culture. So what are some of the benefits of a national cancer control plan? There are many. There are probably twice as many that are on this slide, but I want to go through each of these because I think they're important. So a national cancer control plan ensures that policies that are implemented utilize the best available evidence. It also ensures that resources are utilized maximally. So I don't think I've heard anyone say there are piles of money or lots of health professionals sitting around waiting to find work. And so in the context of a plan, you can make sure that programs that are set out and implemented are done so to the best use of all resources. A national cancer control plan is actually a great communication tool. You can communicate the challenges, the needs, and what is that strategy and that path forward. You can use it again as a communication tool to increase resources, the financial, political, and social support. You can coordinate efforts across cancer and across the health sector. So again, we've heard already today that a patient does not walk in as a cancer patient, but there are existing NCDs that patient is dealing with. So how do you coordinate efforts across disease areas? We need to ensure accountability. So we need to make sure that there is a dedicated person or group who will be responsible for carrying forward the plan, and also have a monitoring and evaluation plan. And finally, the ultimate goal really is to improve health outcomes. I'm also really pleased that so many folks have mentioned that it's a whole of society. So it is not a single person, it is not a single ministry, it is not a single cancer society who is responsible, but it really needs to be embraced by all of the sectors, and that has been prevalent throughout the talks already. Again, we have to take into account the social determinants of health. Again, what are the other risk factors? What are the other burdens? This does take time. So it's a long planning horizon. It's not going to happen overnight, but it's worth the investment. And we have to make sure that there's government support for this broad-based cancer control. So I borrowed this slide from UICC, and again, I won't go into it. You've seen a version of it already. But what I do want to point out is, we're here. And I think Carrie's the one who already mentioned there will not be another high-level meeting. But I really look forward to the update of this slide, and what are those milestones that we can look forward to ensure that we meet the 2025 and the 2030 targets. One of the targets that was outlined in the 2013 Global Action Plan was that every country would have a national cancer control plan. And this is really where the story of the International Cancer Control Partnership begins. So this was started in 2012 with organizations who had a stake in national cancer control planning efforts. And now we have roughly 30 partners, and we have a steering committee that helps to guide our own strategy as planners. So see, we do practice what we preach. We provide resources like toolkits and other planning reference guides here on the portal, and here's a screenshot of some of the resources that are available. Here's the website of the portal. Everything here is freely available. We also publish all cancer plans and NCD plans that are available. We've mapped them, so it's a nice looking map. You can search by region, by plan type, by resource type, by language. So what did we do? We took this partnership and we said, we really want to understand what's going on in the global space. So in partnership with WHO and UICC, we undertook the review of 500 documents from 158 countries. There were 67 expert reviewers in 16 different countries. And the findings were published in the Lancet Oncology just in time for the high-level meeting. Here's the reference here. Now, if we look here, it's not equitable, the distribution across the regions. So we did find that in 2000, 49% of countries had a plan. And again, this varied across regions. In 2015, 87% of countries had plans. But despite this increase, many countries do not address country-specific issues. So now let's talk a little bit about the paper. Again, this is from the Lancet Oncology paper. So the majority of the countries seen in this first pie chart either had a National Cancer Control Plan and an NCD plan, or only an NCD plan with mention of cancer. So the NCD plans that we reviewed had to have some mention of cancer in their context. A limited number of countries only had an NCCP plan, and some countries had other documents that were reviewed. Plans were available across all WHO regions. 29% of the countries in the Euro region had plans. 22% of the countries in the Afro region have plans. And when we looked across income groups, which is this third pie chart, high-income countries and upper-middle-income countries were more likely to have plans. So overall, 61% of plans mentioned these country-specific goals, and 70% reported targets that aligned with the global commitments. And again, I think that's a testament to a lot of the global community, UICC and others, who are making sure that these global commitments were communicated and integrated into country-level strategies. So overall, countries had strong inclusion of early detection, as noted by a larger infographic here, with strong emphasis on cancer screening than other interventions. The delivery of cancer services and the health workforce, as noted by smaller infographics, were poorly addressed across the plans. When it comes to treatment, almost half of the countries specified radiotherapy services. However, in low-income countries, this was only 30%. Radiotherapy was only mentioned in 11% of countries that had NCD plans, and 61% of countries with national cancer control plans, again, emphasizing the need for integration across NCCP and NCD, but to have that specific national cancer control plan to outline the needs and expectations. Okay, so now we get to implementation. So this goes to the governance. 79% of countries mentioned a mechanism to implement and monitor a plan, but only 7% detailed how monitoring evaluation would be undertaken. You get what you measure, and if you don't have a plan, it's going to be really hard to know when you've been successful. In terms of budget, 55% of countries listed the need to budget, so they knew they needed to budget, but only 10% provided details on how to cost a resource. So again, going back to the point of an NCCP plan, there aren't buckets of money or loads of human resources lying around, so you have to plan for that need. In terms of early detection and screening, 80% of the countries included breast cancer screening, and 85% included cervical cancer screening. So I want to pause here and, in a sense, jump a little bit ahead of myself and say that we were really on a limited time frame. We wanted to make sure that this paper got out in time for the high-level meeting. But there is a huge opportunity now to look at what are the outcomes in countries that actually mention breast or cervical cancer screening. Did mentioning it in the plan actually have any impact on the outcomes in the country? Because that's what we really want to get at, improved outcomes. In terms of prevention, countries acknowledge the need for increased physical activity. 91% of the countries that had plans acknowledged that. And also, 86% acknowledged the need for obesity reduction, but less than half of the countries had a dedicated program to address physical activity or obesity. So I took a moment to look at what did Hong Kong have registered in the ICCP portal. And so I do want to talk to some of the previous speakers about the SAP and the CWEG work. But Hong Kong does have an NCD plan. And I was really excited by the subtitle, which was Make a Difference. And I really think the plans can make a difference when they're implemented. They mentioned prevention and control in the NCD plan. They mentioned the global perspectives. They talk about the local situation. They talk about strategic framework for implementation. So within the NCD plan, there is a mention of cervical cancer, and I've highlighted that section here on this slide. So we heard earlier by the Honorable Dr. Chang, the Cancer Coordinating Committee that started in 2001, which led to the cancer expert working groups, which were mentioned by Dr. Chan. These do focus on the highest burden cancers. We also heard earlier about the SAP 2025. And again, these are documents which I do think would be of benefit to the global community, and I would like the opportunity to look at them further. So in summary, if we are going to make it to the 2025 and 2030 goals, we have to have realistic priority setting, robust costing, I cannot emphasize the costing aspect enough, and a budget for cancer programs. As we move towards universal health coverage, and not every country is going to meet that goal, I'm going to speak for the US right there, we have to have evidence-based national cancer control plans, again, that are financed and implemented. We need plans because plans do lead to that effective investment. And the international cancer control partners, using the collective network and resources that we have, want to take the findings of these studies and, as I mentioned, really look at what the next step is. How does mention of a particular aspect within a cancer plan impact outcomes? On the ICC portal, we do have a link to the Lancet Oncology paper, as well as a link to this 2-page summary that was developed by UICC in preparation for the high-level meeting. This highlights a lot of the key findings and key points of communication for policymakers. And if I could just get a little specific for a moment, we do work with regional partners. So with the European Society of Medical Oncology, we'll be having our second session at the upcoming meeting in Munich. Last year, we really emphasized why medical oncologists need to know what their cancer plan is in their country and how they can get involved. Again, it's that multi-sectoral approach. This year, we're going to talk about the sustainability, accessibility, and affordable cancer care that can be mentioned within the context of NCCPs. And at that session, we'll have speakers from Belarus, the Czech Republic, Kazakhstan, and Romania. And quickly, I want to put in a plug. Every year, the NCI hosts a summer course in cancer prevention. This year, the applications will be opened on November 15th and closed on February 1st. And 2 websites to note here: the overall Cancer Prevention Fellowship Program information, and the Center for Global Health does provide limited funding for participants from low and middle income countries. So I've gone quickly through the Lancet Oncology paper and the partnership. I welcome questions during the panel or during lunch or during one of the breaks.